All right, welcome back, everybody. You know, a change in the law is actually going to give thousands of women struggling with infertility in Connecticut new hope of having a child.
In the new year, the age limit on insurance coverage for infertility treatments is actually going away. The Center for Advanced Reproductive Services shed some light on how your 40th birthday no longer has to be the end of a dream. Here at the Center for Advanced Reproductive Services at UConn, patients like 39-year-old Tara Costanzo are breathing a big sigh of relief.
We're in the process right now, and if it doesn't happen during this process, I turn 40 the first of the year, so now I know that the pressure's off, that I'll have the opportunity in the next year to be able to use our other IVF that we have with our insurance policy.
Starting January 1st, 2016, health insurance plans sold in Connecticut can no longer limit infertility treatments to women under 40. Instead, it will depend on a woman's hormone profile and individual health. Why? In part because the science behind having a baby has changed.
How's everything going?
I'm doing good.
Dr. Lawrence Engmann says 25% of patients here at the center in Farmington are 40 or over, and many are getting pregnant.
A woman of about 40 years of age has about 35 to 40% chances of getting pregnant, depending on the type of treatment that they do. There are new tests that we can do now that can tell us what a woman's ovarian reserve is. That is, what the number of eggs that they may have within the ovary, and it's fairly reliable.
Kate Weldon LeBlanc is the executive director of Resolve New England, a nonprofit agency that helps people struggling to become parents. She says at least 75,000 women in our state have infertility problems.
Because it's such a private issue sometimes that I think people don't realize that women in their own community and right around their own family and friends are struggling with this but maybe don't know about it.
And many may not know the change in the law will help them.
Advocacy groups like us and providers in Connecticut and a lot of people who just care about this very much are trying to get the word out that if you maybe in the past thought that door was closed to you, it is open. You know, it is open again, and that's why we are so excited.
People are getting married older and later in life, and that shouldn't stop them to have the opportunity, if they have obstacles, to actually conceive and have a family.
Davina Fankhauser couldn't agree more. After a 12-year struggle with infertility before finally giving birth, she's now the founder of Fertility Within Reach. After lobbying to change laws, she now teaches couples how to advocate for themselves.
It's a huge victory, and it's really exciting because I remember when the Affordable Care Act was first presented, there was a lot of concern that it would hurt infertility patients, and what we're seeing here in Connecticut is that it's actually helped patients.
The Affordable Care Act bans age limits that are discriminatory, so now coverage for infertility will depend on an individual's health profile, not age.
I think it's important for women, all women, to have a chance of having a child of their own. And there should not be any barriers to these women. And I think putting an age barrier in terms of insurance treatment and offering treatment, it's unfair. And it's important for all women to have a chance of achieving their dream in future.
So now that you don't have this ticking clock, does that ease you?
It does. I at least feel that it's one less weight to bear.
And that's all you need is more stress when you're trying to have a kid, right? So this reduces that.
At least take some of the stress away. So the new law takes effect January 1st. So if you are 40 or over and want to see if you could be covered for treatments, the first step would be a consultation with an infertility specialist. They'll get that workup on you and help with your insurance companies. The Center for Advanced Reproductive Services is located right in Farmington, and the website is uconnfertility.com. We'll have a link on betterct.com.
All right, Alyssa.